Welcome to Your Wellness MD podcast. This is where family physician and wellness expert Dr. Daniela Steyn and her life coach sister JB share holistic solutions for your everyday health and wellness challenges. We explore the connection between a healthy body, mind, and soul, and share tips that will enable you to thrive. Thanks for joining us today.
Welcome to your Wellness MD podcast. I'm JB.
And welcome from me, Dr. Daniela Steyn.
Today we are discussing sexual health, an exciting topic and not one that is spoken about frequently enough. We would like to be inclusive during our conversation, and even when we refer to different genders, we recognize that gender is not binary and that our listeners do identify with gender in different ways. As sexual health and fertility go hand in hand, this is part one of a two-part series. In the next episode, we will discuss fertility in females. Dr. D, let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things and the bad things that may be. Let's talk about sex. Do you remember? I think I was in high school when this song was big in South Africa. Giving away a little bit more of my age than I care to, but the good things and the bad things. When we think about sex, when we think about talking about sex, what is healthy, what is normal?
That's the absolute beauty about sex. There's no fixed normal. We usually advise that if both partners are comfortable, safe, and they enjoy the experience, then you're good, irrespective of the frequency or the practices you follow.
Good to know. And Daniela, you're quite the expert on the medical side of sexual health. I know very recently you did a presentation on sexual health for other doctors at the International World Conference on Sexual Health. Tell us a little bit more about that.
Right, JB. The World Association for Sexual Health is dedicated to its mission to promote sexual health, well-being, and rights for all. So the goal of the conference was to facilitate sexual health through education and health promotion, and they're really advocating for social justice. Sexual education is meant to foster human development and to facilitate sexually healthy lives for people at all the different stages of their life cycle. So it was an awesome opportunity to share my experience in treating sexual health concerns with holistic medicine, but then also to be able to learn from the best experts all over the world regarding the latest research on sexual health.
How often do patients come to you with sexual health problems?
Actually, quite often. It is estimated that about 40% of people will have some sexual health-related concern over their lifetime.
What types of sexual problems do people have? What do they come and see you about?
Sexual health and vitality go hand in hand. People with less vitality due to a chronic medical condition or anxiety, stress, or burnout experience decreased libido and then also decreased sexual satisfaction. So in addressing low libido and impaired satisfaction, it is important to me as a doctor to look at my patient from a holistic standpoint. So what that means is to look at the whole person. Addressing general wellness, would focus on mindfulness, movement, exercise, and herbal therapy. All of these play a role in sexual health. So in addressing any sexual health concerns, we use a whole body approach, not to look at only one area. So if a patient comes in and say, can I have a prescription for testosterone or prescription for Viagra? Then I say, wait, let's look at everything. You as a person, we have to do a full physical exam maybe. We have to look at what medication you're on, which side effects it is, which stages, how do you eat? It's way more complex.
What do people complain about?
The most common sexual question and concern from patients can be, or we can actually divide it into broad categories. The one is regarding sexual drive, desire, libido, the ability, and their satisfaction. And then the other one is regarding fertility. And fertility is a big thing. That's why it's good if we dedicate our next podcast to fertility. And physical health goes hand in hand with sexual health and fertility. So when we address the medical illness, we maybe need to treat an infection or manage a chronic disease or treat hormonal imbalances. All of these things are keys to more optimal sexual interaction. A treatment plan usually addresses lifestyle, nutrition, and then botanicals like herbal therapies can, all be helpful.
What is the most common concern that you get from women?
Pain during sexual intercourse and low libido. So let's talk about pain first. So when someone experiences discomfort in her vagina, that could be due to a bacterial or a yeast infection. Vaginitis is one of the most common reasons for women to seek medical attention. So first, your doctor will do swabs to rule out a bacterial infection. And it's so important to do this because if you have an untreated infection or just a partially treated infection, that could lead to infertility in the long run. So first, we want to make sure you don't have an infection. If you've done vaginal swabs, there's no infection. The next reason could be due to a change in the pH of the vagina, because in the vagina, there is a lot of natural bacteria. And if you just have a change in the pH or the sugar level or your blood sugar levels or not enough good bacteria, all of these things can really upset that delicate ecology of a healthy vagina and can lead to painful intercourse.
Okay, so you're saying there are actually bacteria in the vagina.
Yes, and there should be.
What type of bacteria is this?
The most common bacteria in the vagina is Lactobacilli. And the role of Lactobacilli is to inhibit the adhesion and growth of infectious organisms. So it means you have to have lots of good bacteria to prevent bad bacteria.
Okay, Lactobacilli. That's the bacteria in yogurt and probiotics, isn't it?
Exactly. Lactobacilli keeps the vagina healthy through 3 different mechanisms. The one is to actually produce lactic acid, and that gives a normal pH. So a normal pH in the vagina is quite acidic. That is a pH between 3.5 and 4.5, and that inhibits the growth of many disease-causing organisms. And then there's Lactobacilli also produces hydrogen peroxide, which inhibits bacterial growth, and Lactobacilli competes with other microorganisms like Candida albicans. It means that if the area is full of good bacteria, then there's not place for bad bacteria.
Okay, and what put this pH bacteria out of whack inside of the body?
Sexually transmitted infections like chlamydia or gonorrhea or trichomonas or any bacterial infection can change it. Candida albicans infection is so common. It has dramatically increased over the past 50 years with the increase of antibiotic use. So if you use antibiotics, it kills off all the good bacteria that you need to have in the vaginal area, and then candida overgrows. Or eating too much sugar makes candida overgrow. And also, some people have it without knowing it. So if your partner has candida, your partner can reinfect you every time when you have intercourse.
Okay, so too much sugar in your diet or even allergy to something such as dairy that you might not even be aware of could cause candida.
Yes. So after menopause, the vaginal lining can become very thin. That's due to a lack of estrogens. We call this atrophic vaginitis. This is very common. Many menopausal and postmenopausal women experience really painful intercourse, and then they have increased susceptibility to infection. So they're more likely to get a bacterial infection from normal skin bacteria, more likely to have vaginal itching, more likely to have burning. A common treatment for this is to prescribe an estrogen cream where you apply locally estrogen on the vaginal area that helps to thicken the skin. But then for women who don't want to use estrogen, there are other ways we can treat it. We always advise women with atrophic vaginitis to avoid using things that make it worse, anything that dry out your mucous membranes, such as antihistamines, alcohol, caffeine, and diuretics. And it's important to stay hydrated, to drink at least 1.5 liters of water a day. That's 48 ounces of water a day. And then interesting, to have regular sexual intercourse is beneficial, as this increases blood flow to the vagina and it improves tone and lubrication. And then just in general, lubrication is very important. As you get older, your body might secrete less lubrication. And you can buy lubrication at a local pharmacy, something that's allergen-free, smell-free. Many people use KY jelly.
Well, that's good to know. If you have challenges, ladies, just have more sex, lube up, and then have some water too. It sounds like it. And then you mentioned that nutrition can help avoid the vagina's pH and bacteria are put out of whack. Which foods will help?
So foods that are rich in phytoestrogens.
Yeah, I know exactly what phytoestrogens is. Not.
Those
Please
are-
give us some examples of phytoestrogens.
Those are foods such as flax seeds, soybeans, edamame, dried fruits, sesame seeds, garlic, peaches, berries, wheat bran is a good source. Oh, and fish oils. If you want to buy something, there's a supplement called hesperidin. That's a flavonoid that you can use in combination with vitamin C and vitamin E. And there's a couple of commercial products like Cynansim wilfordi is the name of one. The other one is Phlomis umbrosa, and the other one is Angelica gigas. So a good herbalist or pharmacist will be able to help you. These ones I mentioned now has been shown to significantly decrease vaginal dryness and improve the symptoms of atrophic vaginitis for people who don't want to use estrogen.
Well, that's some great tips. Yeah, thank you. And about what to avoid and what to eat, take a supplements. What do men complain about?
So men complain about erectile dysfunction by far.
What exactly is erectile dysfunction?
So erectile dysfunction is the inability to attain or maintain an erection of the penis sufficient enough to have satisfactory sexual intercourse. So this is a very common problem, what people present to in a family physician's office. And first the thing, always, we need to exclude medical causes. So if any of our listeners, struggle with this first, go to your family physician. Definitely, we didn't try to treat this with a podcast. Medical issues need to be sorted out by your doctor because any illness that affects your cardiovascular health will impair blood flow to the penis. And the same way that you have cholesterol buildup that cause blockage and decreased blood flow to the heart. Say you have decreased blood flow to the heart, you can have chest pain, angina. You might not be able to run as fast or as far. You can have a heart attack. That same cholesterol buildup happens throughout your body. And so you'll have the same buildup going to the penis. And the penis needs adequate blood flow to maintain an erection. So cholesterol buildup will impair that blood flow. And poor blood flow, we call that vascular insufficiency or atherosclerosis or just unhealthy arteries. That is often the root cause of some people's erectile dysfunction. So rather than, just giving someone an aphrodisiac, you must first treat that vascular health. And cigarette smoking is a big one, tobacco use, that causes free radical damage inside your arteries. So the same way that it increases your risk of a heart attack or a stroke, it puts you at risk for erectile dysfunction. And hormonal illness, such as diabetes, low thyroid hormone, low testosterone, high prolactin, high estrogen. These can also negatively impact sexual health for men.
Do men have estrogen? I thought that's more of a female hormone.
Correct, yes. So naturally, men do have some estrogen and women have some of the male hormone testosterone naturally. But when there is too much estrogen, it can impair your sexual function. When you're overweight, in our fat, both male and female, in our fat, our hormones get converted into estrogen. This can cause you to have more estrogen than your body needs. So for a woman, that might almost be like you're on birth control and make it harder to fall pregnant. And then for a man, that can cause erectile dysfunction. Another way we have too much estrogen is from our diet. So all animal products contain some natural estrogen, just because animals does have estrogen the same way humans have estrogen. But most of our food have extra estrogen to make the animals, help them to get fatter, to have more meat on their bones. Then we get that extra added estrogens. That's why you'll often see when you buy food that there's no extra hormones added. No, cow milk also contains estrogen.
So you're saying eating a healthy diet and avoiding animal hormones are helpful to prevent erectile dysfunction.
Exactly.
If some of our listeners think they might be having too much estrogen, what can they do about it?
So there are certain foods that can counter the effect of too much estrogen in your diet. It's foods that contain indole 3-carbinol, and those foods reduce the estrogen effect in men. We get these foods from certain veggies like cauliflower or bok choy, broccoli, and Brussels sprouts. And then also these foods, has also been shown to reduce the risk of prostate cancer in men. And then there are other foods that help to increase testosterone. And that's why we had this whole podcast about nutrition, just because nutrition is so important, to balance your hormones for every aspect of your life. So you can also, if you don't have enough testosterone, if you eat foods like mushrooms or the spices turmeric and curcumin, they have been shown to increase natural testosterone levels in men. And chronic alcohol use can lead to low testosterone and increased estrogen levels. And then this can cause gynecomastia. That's when men develop bigger breasts, and it can cause erectile dysfunction as well.
Let's talk about fertility. How does diet affect fertility?
Okay. So there's different ways. In general, just being overweight or underweight for women decrease their chances of falling pregnant. So there is the food itself, but then just if your diet is in such a way that it causes you to be overweight or underweight, that can change your fertility. Overweight men also have a harder time to conceive. One of the reasons is the risk of erectile dysfunction, which we discussed, but then men with an unhealthy weight has also been shown to have lower sperm count because the sperm itself won't swim as fast. We call that reduced motility, or they will have a 50% reduced sperm production. And then if you look at the sperm itself under a microscope, there is increased DNA fragmentation of the sperm. So this means the sperm is not as healthy. Another way that being overweight causes men to be infertile is because that extra abdominal weight increases the temperature of the scrotum. And then also hormonal changes. That's a big one. The level of your total and free testosterone is actually reduced in overweight men, and it's in proportion to the level of their overweightness or their obesity. So estrogen is increased because that, as I said, that normal male hormones turn into estrogen in fatty tissue. And then the estrogen that's produced, they have a negative feedback on the gonadotropin production. So it reduces FSH, which is your follicle stimulating hormone. And then having less FSH further reduce your testosterone production, reduce sperm production, and then increase body fat and a sedentary lifestyle associated with raised testicular temperature, which further affects this production. So it's a little bit of a bad cycle that starts happening.
What can a man then do when a couple is trying to conceive?
So to be moderately active, it doesn't have to be excessive, but to be moderately active and to maintain a healthy weight is very important.
And then once someone is at a healthy weight, what else?
Okay, so that's where it gets quite interesting with nutrition. So many things you can do. Antioxidants such as vitamin C, beta carotene, selenium, And vitamin E has been shown to be very important in protecting the sperm against damage and to improve male fertility. Zinc is important for male fertility. Low levels of folic acid in the seminal fluid is associated with increased sperm DNA damage. Vitamin B12 deficiency is associated with reduced sperm motility. Motility is that ability of the sperm to swim, and also decreased sperm count. And I find it's just very important to tell your doctor that you're trying to conceive. So your doctor can have a look at the current medication that you're on. There's drugs such as high blood pressure medication, some cancer medication like cyclophosphamide, anti-inflammatories like sulfasalazine. These medications have an adverse effect on male fertility.
And what about smoking and using marijuana?
In men, cannabinoids have been found to inhibit testosterone production. And then when you test the sperm, it does reduce energy production in sperm, and it decreases sperm motility and decreases sperm function.
Well, I know there are many herbs that are helpful.
Yes.
Which can you share with us that help men with fertility?
Yeah, so Chinese ginseng helps, tribulus helps, and ashwagandha is very good.
And then herbs that are good for libido, or any other supplements that are good for libido?
Before you take a supplement for libido, it's helpful to figure out why you have a lower libido. A patient with depression might present to me in the clinic with the main concern with a low libido, decrease in sexual desire. But if I don't treat their mental health first, then just prescribing an aphrodisiac or hormone therapy, won't be really that helpful. But then on the flip side, the medication we prescribe for depression, antidepressants we often give, we call it selective serotonin reuptake inhibitors. And it's a big group of medication. So all those different medications does inhibit sexual function. So it has a lower libido as a side effect.
Okay, so sounds like depression can cause a lower libido. However, drugs that treat depression can also lower the libido.
Unfortunately, yes. So promoting a healthy lifestyle goes a long way in restoring optimal serotonin levels. Several lifestyle factors impair the natural conversion of tryptophan to serotonin. So serotonin is your happy hormone. And then if you correct these lifestyle factors, such as an unhealthy diet or not enough movement or high sugar intake or a nutrient deficiency or a phytonutrient deficiency, these things all goes a very long way in improving sexual health.
I've heard some foods are aphrodisiacs as well. Is this true? Foods like chocolate, oysters, spicy chili peppers.
You are absolutely right. You can also add to that list pistachio nuts. Strawberries are good, watermelon, artichokes, asparagus, and figs.
What exactly is an aphrodisiac?
So an aphrodisiac is a substance that increases sexual desire, sexual attraction, or sexual pleasure. And aphrodisiacs can be classified by their type of effect, whether it's psychological or physiological. Aphrodisiacs that contain hallucinogenic properties, like buffo-toad, and that's bufotenine is found in the skin and in the glands of buffo-toads.
I thought that was just an urban legend.
It's a thing. They have a psychological effect. And that psychological effect can increase your sexual desire and pleasure. Then there are aphrodisiacs with a physiological effect. So that means physically in your body. So those aphrodisiacs contain smooth muscle relaxing properties. Yohimbine is one. This has a physiological effect that affects your hormone levels, and it also increases your blood flow. Horny goatweed is another one that's very commonly used amongst my Chinese patients because it comes from Chinese folk medicine.
I had no idea. I'm sure many of our listeners will be happy to learn about all these supplements. Are these more natural supplements safer than something like Viagra?
JB, unfortunately, natural doesn't always mean safe. side effects, they can still have side effects like nausea or anxiety or irregular heartbeat or making you feel restless. And there are some illicit drugs that are aphrodisiacs. It's substances like ecstasy or methamphetamines, and they are definitely not safe.
Yeah, how do I know which drugs are safe?
So if a medication is FDA approved, it means that the Food and Drug Administration has tested it and felt that it's safe enough for citizens of the United States to be using. So that often helps to look for that. Euhembine is an aphrodisiac that's FDA approved. That's a substance that's found in the bark of yoam trees in West Africa. So it was traditionally used in West African cultures in which the bark would be boiled and then the water would be drunk like a tea that you would boil. Instead of tea leaves, they boil the bark. And they believe that improves sexual desire. And that's really been shown in studies to be helpful, and to be safe. And that's why it's FDA approved. And this specific drug helps men through both pathways. It helps with the psychogenic effect, but it also helps with the physiological response.
Interesting. What else?
Ginseng. Especially red ginseng has been shown to be, more effective than placebo in improving erectile dysfunction. And also in women, it improves sexual arousal during menopause. Fenugreek is a popular Ayurvedic medicine, and it's an anti-inflammatory and it's a libido boosting treatment. Maca is a sweet root vegetable. Its nickname is Peruvian Viagra. This is very commonly available as a powder at any health food store. I tried it. The taste is very bitter, but you can add it to your smoothies, and then you won't even taste it. Ginkgo biloba is derived from one of the oldest species of trees called the Ginkgo biloba tree. It works as an aphrodisiac by helping your blood vessels to relax, and it increases blood flow to your genitals. And we need that increased blood flow to genitals for optimal sexual experience, irrespective of gender.
Wow, that's a lot. I had no idea of all these amazing, more natural remedies. So in summary, even if you feel uncomfortable, embarrassed, if you have any concerns about your sex life, you should start by chatting with your doctor.
Mm.
And then obviously you can have a conversation with your doctor. Your doctor might check your meds, see what else is going on. But then lifestyle, what you eat, what you don't eat, how much water you drink, all of those choices actually impact your sexual life.
Definitely anything that makes you healthier, eating better, moving more, lowering your cholesterol, improving your circulation will improve your sex life. And then once you've had addressed all these lifestyle issues, you can start trying botanicals.
Wonderful. I hope that our listeners found this super interesting today. And I look forward to chatting with you in our next podcast episode, specifically about fertility.
Please leave us a review for this podcast. If you enjoyed it, forward it to a friend who might enjoy it. Leave a review, subscribe to our podcast. We really appreciate your support. And chat to us. We respond to all the messages we get. So let us know what your thoughts are, what you think.
Wonderful. Thank you, Dr. D. See you next time. Be well.
It was fun. May you have great...
Vulva's happy.
May you have great sexual health. Take care.
Thanks for spending your time with your Wellness MD Doc Daniela and JB today. For more episodes, subscribe to our podcast. We would love to connect with you at info@wellnessmdhealth.com. And remember, you were created to thrive. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.